Hello, everyone, and welcome to ATP Live Monday. I am Gbemisola and it's my pleasure to be here today. Yeah, so welcome. How has your day been? So you're joining us. Let's just share the video and invite everyone to be part of ATP Live Monday. I'm also just going to share the same. So please join me to share the video. ATP Live Monday is a program brought to you by Ask the Pediatricians Foundation, where you get to ask any question you may have about the health of your children, and we try to answer them in the next 1 hour. But remember that if you still have any questions after the live session, which is just 60 minutes, you are welcome to post your questions on our Facebook group Mondays to Saturdays, and we will always be there to answer your questions. So, thank you so much. Good evening, welcome. So, I'm just sharing the video, so please join me to share as I share as well. Let's just take the first few minutes to share and make sure everybody can see us. Just watch it on Instagram. Thank you so much for joining. I can see you. Uh, just give me a few more minutes to make sure all our groups have access. And I also share to super parents because I know we have parents with children with additional learning needs who may also have questions for the pediatrician. Okay, I think we're almost done. Okay, I think I've done all the sharing, just all the pinning. So let's just do that. Welcome. How's your day been? I hope you all had a nice Easter. We were not here last week because Easter Monday is a public holiday. So all of us had our uh, break, and I hope you had a nice time with your family. Um, so I'm just trying to pin the videos now. I've done the sharing, just the pinning. But while I'm doing that, if you have any questions about the health of your children, you can start to put your questions in the comment section. If you're watching on our Facebook page or you're watching on the Instagram or YouTube channel, just drop your questions directly under the video and we'll be able to say it. If you're watching in the Facebook groups, because Facebook does not allow us to stream directly to groups, so if you're watching in the groups, so you have to click on the video so that when you click on the video, you will go directly under the video to drop your question. Otherwise, I may not be able to see your questions and it will be in the group, but I won't see it from my studio. So, but if you're just listening, that's fine. You don't need to do anything. You can just keep listening. And then please, when you're asking question, please start with the age of the child. It amazes me how many people ask questions and they don't put the age of the child. For us as pediatrician, is so crucial. We need to know what group, what category of persons we are answering questions for, because that is so crucial in the way we answer the question. So please always start with the age of the child. Always go straight to the point, just tell us what is necessary for us to know. And then, yeah, good evening. Hope Elijah, good evening. So go straight to the point, tell us what is important, and please ask questions. It's also amazing how many times people just like ventilate on our group and just write all their worries, but they don't ask a question, and I'm not quite sure what they want us to do with that information that they've shared. So please don't just ask questions. Miss Fumi on Instagram, welcome. Shaida Taudu, Miss Anelo, Official Dwara, and Miss 359. Everybody, you're welcome. I see you all. Thank you so much for joining. So please ask questions, be very specific. Good evening, Princess Odiga. Welcome. Good evening. So please ask your questions. Start with the age of the child. Tell us what is relevant. If you're asking about weight, your child is not gaining weight, I need to know the weights. Okay. If you're asking about the height, I need to know the figure. If you're asking, just try, you're very what you think is important for us to be able to answer your question, always include it, and that will be helpful for us. So thank you so much. Instagram, please ask your question. I'm doing well. Thank you, Miss Fumi. I had a nice, lovely Easter break, full of work, but still okay. All right, I got a question from Yabrifa Abigail. Good evening. Please, how many times do I have to brush my child's teeth? Okay, that's a very lovely question. Thank you. Your child is 19 months. Okay, thank you so much for telling me the age. So the dentist recommends that we should brush twice a day. So they want you to brush the child's teeth in the morning after breakfast. Actually, I don't know. Yeah, that's what the dentist wants. But most of us, we usually brush before breakfast because the routine is a little bit tricky to do it after breakfast. That's why in some schools, actually for preschool children, they actually let them brush their teeth in school, because they would have had their breakfast. So you should brush their teeth after breakfast and the last thing at night before they go to bed. So twice a day, use age appropriate toothbrushes and fluoride containing toothpaste. So that is what the dentist wants. And let me also just remind you that the dentist wants to bring your children to them from the age of 1 year. They want to see the children every 6 months from the age of 1 year. So most of us don't remember to do that. But if you can, the dentist will be very, very happy with you, because that will give them opportunity to pick up any problem these children may have on time, and then they'll be able to fix it. All right. So thank you. Yeah, briefer for that question. And I hope everybody has learned from it. And if you want to learn more about oral hygiene, what the dentist recommend, if you go to our website, www.askthepediatricians.com, dentists have written detailed articles on oral hygiene and how to do it. And especially for toddlers that don't like brushing their teeth and they have what we call teeth brushing resistance, there are also strategies for you to use. So you may want to check up our website. I hope you know where our website is. Let me see if I can just type in the code, our website links for you. So, but if you just Google Ask the Pediatricians, you will definitely get to our website. All right. Okay, the next question I have is from Princess. Just check Instagram, people. Instagram, you're not answering question yet. Please ask your questions. Um, say a princess is saying, how can I help my 2-year-old from sucking her tongue? Okay, so children sometimes have what we call habits, childhood habits, and sucking tongue, sucking finger is one of those habits that children have. Okay, but you said the tongue is actually getting bigger. That's another thing. So your child's tongue does not get bigger from the child sucking on it. That is not it's not possible that way. So the child's tongue does not get bigger from being sucked on. So if your child has a big tongue, that's a different thing entirely, because some children actually may have what we call very big tongue. And so it's not as if the child is even actually sucking the tongue, it's just that the tongue is so big and it cannot stay inside the mouth of the child. And in that case, you actually need to see us. You need to see a pediatrician, because either the mouth is too small or the tongue is too big, whichever way. There are some medical conditions that can cause that, and we may need to investigate that. So, but the child sucking the tongue does not make the tongue big. So actually, I was actually going to just tell you that that's just an habit. Most children are going to outgrow the habits and you don't have to do anything. But when you introduce the tongue is getting bigger scenario, then you completely take me off my initial answer course, because the tongue does not get bigger from sucking. So if the tongue is getting bigger, I worry about something completely different. So I'll recommend you see a pediatrician so that they can check the baby's tongue for you, really. And number one, to know whether the tongue is actually bigger or not, and if it is, why, and what can we do about that. So that's, but otherwise, if it's just a child sucking their tongue, is an habit. It's just like children sucking their fingers. Most of children do it for comfort. They do it for, just one of those things. But the good news is that most of them will outgrow the habits by the time they're about 4 to 6 years old. And so we just say give them a little bit of time, try and distract them. Sometimes children do it when they are, on their own, or when they are trying to suit themselves, self-suiting kind of behavior. So give them alternative things and all that. That may be helpful as well. So I hope you can get to see a pediatrician if the tongue is really big and you're worried about that. Okay, Miss Fumi on Instagram. My baby is 9 months old one day. When is the right time to get him checked for his genotype and blood group? You could have done that from day one. There are places where you can get your children's blood tests done. And why do you want to do the blood group and genotype anyway? It's not something we request that you should do routinely unless you are suspecting that your child may, maybe for example, if you are AS or your husband is AS, and you want to know whether one of the child has the S gene. But otherwise, we don't expect parents to go around doing blood group or doing genotype. It's not something we do routinely, but it can be done from day one. So there are places where they do what we call neonatal genotype, but some labs cannot do that. It's not every lab that can do that. Majority of the labs can do genotype from like 6 months, when the child is 6 months, because there are different kind of hemoglobins that we have in our body. So we have hemoglobin A. So all those A's, each of them are hemoglobin. So we have hemoglobin A, we have hemoglobin S, we have hemoglobin F, and we have all hemoglobin C and the rest of them. So when babies are born, the most dominant hemoglobin they have is hemoglobin F. That's the one they have in the womb, and it's still a lot in their blood. So if you do, for people who don't have the right kind of instruments, if they do the hemoglobin genotype, they get it confused. The F is still so much, so they may not be sure what they're saying. So, but by the age of 6 months, most of the hemoglobin F has cleared. So most of what you are going to have is not the A hemoglobin, or the C, or the S, or the mixture of them. And then so it's easier for them to be able to now say, this method, we know this is the genotype. And these days, I'm going to, while I'm on this topic, because I was very unhappy over the weekend, I saw somebody privately, and a child had just been diagnosed with SS. And but what worries me was that diagnosis was mixed for so many, a couple of years. The child was diagnosed almost age of 3. I was really very upset about that, because, and again, it all boils down to all these genotype people do, that they gave parent wrong information. And even when they were testing the child genotype, they kept coming out with wrong information again. At the end of the day, it took them going to the Sickle Cell Foundation before they get the right diagnosis. And I'm saying that for those of you who are suspecting you may be AAS, or you may be suspecting you're AAS and you're planning to marry somebody who is AA and all those kind of scenario, please don't just go and do it in all those roadside labs. Okay, go to what we call reference laboratories. Reference laboratories are actually attached to institutions, so like maybe the teaching hospital, maybe a university, maybe like Sickle Cell Foundation. These are very standard labs, so they are called reference labs. So if you are in that kind of scenario, please don't do your genotype in your next door lab people that you don't know, no control, no quality control, nobody is checking what they did or not. They are creating a lot of problems for us as pediatricians. They are creating a lot of problems for families, because they keep giving people wrong genotype. And this is not the first time this has happened. It has happened to somebody very close to me as well. So we see it all the time. In fact, so usually when people ask me my genotype, and I just go to Sickle Cell Foundation or Lutz or any of those teaching hospitals and do everybody's genotype again: the father, the mother, the child, the children, everybody. Because sometimes all the daddy will be claiming I'm AA, and the child is showing signs of sickle cell. So sometimes we just do everybody all over again, because the wrong information is what is causing the confusion. So please, I just thank you, Miss Fumi, for asking that question, because it just reminded me of that scenario over the weekend. Each time I've gone through that scenario, it's not the first time, it's not the second time. It's always very annoying. Okay, very, very annoying. In other countries, they actually do hemoglobin genotype. They screen children when they are born. So if your child is born in the UK, they will screen the child right from the first day, and we will know whether the child has hemoglobinopathy, any of the abnormal hemoglobins or not. But in Nigeria, we are not yet doing neonatal screening. Hopefully, we will get there one day. But for now, please don't do genotype in all those labs. That's honestly the kind of problem those labs are causing in the country. Is really so annoying. Okay, so just for your own information. Lorita, good evening. Major Evans, these are my regulars. It's nice to see all of you on Instagram. Thank you for always coming. All right, so let's go on. Apologies for going overboard with that, but there are some things that just get on my nerves. Okay, Hope LJ, see my baby of 1 year has high fever and sores. Okay, we went to the hospital. Good, she was given anti-malaria antibiotics. The sores are not allowing her to eat, and we asked not to give her vitamin C until the end of the anti-malaria. How can I manage the sores to help reduce the pain? Okay, number one, thank you, Hope, for your question. You could have asked this question at the hospital, or you could also still go back to them for follow up. Please always be confident and comfortable to ask all your questions in the hospitals. I see people go to hospitals, see their doctor, see their pediatrician, then they come home and they are asking questions and ask the pediatrician. I'm like, you are just coming from the hospital. Why didn't you ask them? So that I just feel like people sometimes, I don't know whether we are too intimidating for parents or not, but please be very comfortable. It is your right to ask all those questions, and it is our responsibility as doctors to always answer you. So don't go with the mentality that Nigerian doctors or the nurses, they always shout on us. No, they won't ask your questions. We will try our best to answer, and if they want to try and shout on you, tell them it's my right. You have your right as a patient. We have, even in Nigeria, we have the patient's rights document. So ask your questions and let them ask. Okay, now coming back to your question. So the mouth sores, assuming it's part of the original illness. Number one, I have a lot of issues with the diagnosis of malaria and antibiotics, and I always have issues with it, but I will not go into that today. Let's leave that one. So sometimes when children are ill and they have mouth sores, for example, what we call herpes labialis, some children already have the herpes, it's in the body, but whenever they are sick and there is a problem, the immunity drops, and because the immunity drops, it makes them to, to the virus that was already kind of dormant in the body kind of get reactivated, so children come out with mouth sores. So in places where they have uh, we have the antiviral, usually cyclover. They can actually give you the cyclover to apply on it, and it will heal it fast. We don't tend to have it readily in Nigeria, so we just wait for it to go on its own, So it will go. The vitamin C is not the healing of the mouth sore, so don't even get yourself worried about vitamin C. So, but there are other things to help the mouth sores to heal. So, as the child gets better, most of the time the sauce will also improve on their own. There are also some creams that we use. I've talked about the cyclover. Sometimes we use what we call bonchella cream, something to kind of suit or kind of reduce the pain for the child while the mouth is healing. So that is what we normally give. So if it is really a problem for your child, you can go back to your doctors and they can prescribe something. But most important thing at this time is give the child the food that the child can tolerate. So maybe something light, something not too spicy, even breast milk if the child is still breastfeeding, just give them what they can tolerate. This issue of vitamin C, the issue is not that the child cannot take vitamin C, it's just that you cannot give it together with the anti-malaria. Okay, so because a lot of people ask me, you cannot, so when I'm taking antibiotic, I cannot eat fruit. You can eat fruit. You cannot just take it at the same time you are taking your anti-malaria, because it can affect the effectiveness of the anti-malaria. But if you do it at different time, usually most anti-malarials are taken once a day. So if you give your anti-malaria, let's say in the morning, in the afternoon, nothing stops you from eating fruits, or in the evening, the anti-malaria has been absorb into the body. So the vitamin C you are giving after that is not going to affect it. So it is giving it together that the pharmacists are talking about. It's not like you cannot. You does not mean that for the first 3 days the child is on anti-malaria, they can't take any of the multivitamins, or they can't take fruits or things like that. It's just that at the same time they can react against each other. So that's all we are. But I think if you struggle with that, you can still go back to your doctors, and they can prescribe an alternative treatment for the mouth sores. So that's that. Did your child have blood tests done and all that? Because that's more important. I've talked about it before, but I always still get worried about all our children just being treated with anti-malaria antibiotics. Number one, most of our children don't have malaria and infection at the same time. I mean, life is not that hard that a child needs to have both diagnoses at the same time. It is laziness or lazy practice that make us to just cover, oh, okay, if it's not malaria, it will be infection. Let's just treat the two together. That is actually wrong practice. Ideally, what we should do is to take your child's blood, test for the malaria, test for infection, test the urine as well for urinalysis. Already, this is your child that is having mouth sores. Is this something viral? So those are the things we should be checking for first, and so that we know exactly what the diagnosis is. Is it the malaria? Is it infection? Very rarely the two of them together. So, and we go specifically for what is wrong, and that's what we should treat, not just cover everything. All right, but don't worry. As the child gets better, the wounds will heal, and the child should be fine. All right, I hope that's helpful. John Ross, happy birthday to you. Thank you for joining us. Um, yeah, before says, at what age will a child stop taking vaccine? Okay. I don't know. Yeah, before, are you in Nigeria? Are you outside? I don't know where you're coming from, but sound like your baby looks like a Nigerian child. Okay, so each country has their own what we call immunization schedules. So different countries have different schedules. So if you ask me this question 2 years ago, I would have told you in Nigeria is 15 months, but now it's actually 9 years. So it keeps changing from time to time. It depends on the vaccines that we're giving. So for now, most of our vaccines in Nigeria is 9 years. So we don't technically say you stop taking vaccines. We just like at this point in Nigeria, according to our schedule, the last vaccine on our schedule now is human papilloma virus (HPV). Um, okay, you are in Nigeria. Okay, thank you. So in Nigerian schedule, let me see whether um I have the immunization schedule picture. I think I uploaded it one point. Let me see if I have it in my. Yes, I actually do. Good, lovely. So I don't know whether you can see it's very tiny, but the immunization schedule you can see 9 years. So if this is the Nigerian immunization schedule, it ends at 9 years. So for now, before it was ending at 9 months, then we went to 15 months when we started giving measles two, and then now we're actually doing 9 years. So each time, and we must appreciate our national primary health care development agency, NHPACDA, for all that's done, and also the Pediatric Association of Nigeria, because we keep pushing. When I started ATP, we don't even have pneumococcal vaccine. We don't have rotavirus. We don't have. So if you listen to some of my teaching, then you won't even see all those vaccines. Those days we will tell you have to go and pay. You have to buy pneumococcal vaccine. You have to buy rotavirus vaccine, and you have to buy all those, even meningitis vaccine. But now, this is 10 years on ATP, and now we've added like 4 or 5 new vaccines. So kudos to the Nigerian government, and I I want to implore you as parents, as beneficiaries, that you go take your vaccines, because there's nothing that discourages the government than for them to spend so much money giving us these vaccines for free, and all we need to do is to take our children for the vaccines and we still don't take them. So that is very discouraging, because even though you get those vaccines for free, trust me, they are not free. There's no free lunch even in Freetown. So if somebody is paying for it, every time you take your child for immunization and you get it for free, the Nigerian government paid for it. So they don't like it when they paid and we don't go for the immunization, because our immunization coverage is still so low. So in Nigeria, our immunization currently is at 9 years with HPV vaccine. So please don't forget. Most of us tend to forget even the one of 9 months, because once we've gone for the 14 weeks, then there's a break. Even though some people go at 6 months, the 6 months is just vitamin A, it's not vaccine. But then many people actually forget the 9 months one. Some people forget, so but please go and take them. Even if you've forgotten and you are remembering as I'm talking, I just go tomorrow. Or if okay, maybe most people would have closed by now, just go tomorrow and get those vaccines and they will give it to your child. And don't forget the one of 9 years. Please put this in your reminder, have your immunization card, scan the picture, put this in your phone, set up a reminder when my child is 9 years, there's a vaccine. So we will go for it. So I hope that's helpful. All right. Let me quickly check Instagram, people. I hope I've not missed any question. Instagram, ask your questions. So, because your own question kind of disappear quickly. So I need to keep an eye on it. All right. Princess say you have a 13-month-old. She repeats everything her sisters say. Is that okay? Yeah, that is normal at this age. We will call it echolalia. So children learn how to talk by repeating what they hear. That is how we learn first. So that is completely normal and age appropriate for a 1 year old. Even up to the age of 2 years old, it is still appropriate for them to echo. We call it echolalia, to echo what other people are saying, because that is how they are learning a language. But we will begin to worry about echoing after the age of 2 years, because by the age of 2 years, we expect a child to have developed their own language and to stop echoing, and then that is when it will be an issue. Which is why it's very important you always tell us the age of your children, because some things that may be age appropriate at certain level it will not be. So if you told me your child is 4 years old and is doing that, that is a red flag. That is not normal. But for a 2 year old, a 1 year old, that is absolutely normal. Before the age of 2 years, it's absolutely normal to echo words and repeat words. That's how they are learning language. All right. Is okay. Sorry, you asked a question. Is it okay for her to walk, to talk before walking? There's no law against that. Okay. So walking is usually 12 months level, but some children may walk a little bit late, maybe up to 18 months. We are not worried. So, and there's nothing wrong with the child talking. Talking is on his own, walking is on his own. They are two different domains and they don't disturb each other. So, there's nothing wrong with that. So if your child is not working by 18 months, then you can come and see us for further evaluation. Kota Oluwadamilola Baba says, is there negative effects on a child who is underweight for age? Okay, Oluwadamilola, always start every question with the age of your child. If you're asking about underweight, can you just tell us the weight of the child now and the birth weights? That's, I like to talk specific facts rather than generic. Of course, this is not normal for a child to be underweight. We don't want a child to be underweight. A child who is underweight is at risk of many problems. So we don't want children to be underweight at all. Okay, so there's definitely negative effects. I don't know what you mean by negative, but if you're asking whether there are consequences or danger with a child being underweight, yes, there are. That is why we are talking about nutrition. That's why we are saying exclusive breastfeed your child. Make sure you're giving them appropriate complementary feeding. Nutrition is so crucial because children's immunity and their ability to function is tied to their nutrition. So a child who is already underweight, any little illness, they can just become so ill. and that's why we don't want that. So it's very important. So your child is 1 year 3 months, 8.5. Interestingly, your child is not underweight. Okay. This is why I always want you to tell me the weight and the age of the child, because sometimes parents always make a lot of assumptions, and sometimes the assumption can be very wrong, and I've learned over time. So that's why most times I always want to have the facts. So it's better to always tell the professional the facts. Don't make your own assumption, and let the professional now tell you. So weight is a range. So an average 1 year old should weigh 10 kilos, but some children, if they even weigh up to 80% of that, that is still normal. So 8.5 is still within normal. It's a lower limit of the normal. So which means if it goes down any further than that, then your child is actually already in the periphery of going on the weight, but it's still within normal limits. So what you need to do is to ensure you feed your child properly. I did a ATP hour on fussy eaters, so it's on this same page that you are listening to me now. So if you just scroll down on our past videos, or just type fussy eaters in your search box in the on our page, you will see that video. I want you to listen to that video because it will help you to understand the strategies on how to feed your child who is refusing to eat. So there are strategies around that. So currently, technically, your child is not on the weight, and but we just need you to start walking so it doesn't go into the danger zone soon. Um, yeah. So, Major, can we talk about sepsis in children? We've talked about it before. We can talk about it again, but we've already talked about it before. I doubt there's any topic you want us to talk about that we have not talked about on ATP. We've been doing this for 10 years. So we've talked about virtually any topic that has to do with the health of children. So if you go on our video and just type sepsis, you will see the video, or you see the discussion. Or if you go on our website, I'm sure we have a article on infection in children. You can also read that as well. And I think if you go on the podcast, I think I still talk about services in the last 1 or 2 years. It's something I talk a lot about. So we keep talking about it because obviously the more we learn, so it's always good to learn. So yeah, but we've talked about it before, but we'll keep that in mind also to talk about it again. Um okay, Abigail, so what is the perfect height for year? What age? Your age is missing. You say for year old. The 1 year old, 2 years old, what age of the child? It's not clear. Um, you need to let us know. And then is chubby not tall? Again, just like I told the Damilola, just tell me the figures. Just let me be the one to decide what is tall, what is chubby, what is normal weight. We a lot of parents use a lot of terminologies to describe things, not necessarily correctly. Like Damila thought our child is underweight. Our child is actually not underweight. So as scientists, as doctors, we like facts and figures. We like to know there's exact figures. So it's better to tell me what is the height of the child, what is the weight of the child, and let me decide based on what we know is what we expect for that age, whether it's normal or not. I think that is more important. Otherwise, you will always just make a lot of assumptions and you can be wrong, and just sometimes parents just worry unnecessarily. And so it's important to always know which one. So if your child is 1 year old, an average 1 year old should be measuring 75 cm in length. Okay, because most, if the child is already walking and standing, then we talk about height. If the child is not yet walking or standing, we talk about length. Okay, and it has to be measured properly by a doctor, a nurse, or a health professional, because there's a way we measure height and length. Most parents, you don't measure it properly, so we have our standard stadiometers for measuring it. And if it's a child who cannot stand, there's a one for the length, which is what we will use. So it's more important to tell us the actual figure of your child, and then we can tell you whether they is appropriate. But averagely, a 1 year old child should measure about 75 centimeter. Please take note of averagely. We always use that word, but sometimes parents miss it out. Some children will be a little bit shorter. Some, it's a continuous thing, so it's like that circle. If you remember your maths, the Gaussian curve. So there will be people that will just be a little bit shorter, 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 but they are still normal height. So it is only those who are on the end after the, what we call it, 2.5% cutoff mark, then, or two standard deviation, then those are the ones that will be counted as having abnormal heights and all that. Then number two, your child's weight is also depending on your weight, and I mean, sorry, your child's height is dependent on your height and the height of your husband. So normally when we want to look at children's heights, we calculate what we call mid parental height. So we had the height of the father and the mother and do some subtraction or addition and find the average, and then we will have an idea of what your child's height will be. So if you are short, your husband is short, your child cannot be very tall. So it's something they inherit from you as well. So there are a lot of factors when it comes to height. So it is not just about the child, it's also about the family, the parents' heights as well. So just for you to bear that in mind. Yes, there are reasons why a child may not be tall, but you have not, I'm not going to go answering your question because I don't want to get you unnecessarily worried because we have not even established the fact that your child is short or not. So there's no point telling you why your child is not short. Your child may be short, and then later we find out that your child is actually not short. So that's just not what's doing. So it's better to start first from facts and then we can go forward. So if you fall for, so I've told you number one, we need to know the height of your child. We need to know your height. We need to know the height of the father. Those figures are important. Then we can now decide number one, is he even normal height or not? And if it is not even normal, is it what is expected based on the height of the parents? And then if it is really now short, if the child is really really short even compared to parents eyes and all that, then we can now begin to talk about why. So there are standard process for all this thing. We can't just start jumping to what is making a child short when you have not even told us this child is short. So that's that. So I hope that's helpful. So if you're worried about it, just go to the hospital first, let them measure the child, and then come back and ask the question next week, or you can post it on our Facebook group, and then we'll answer it for you. Elo and Amandala, Eloana, sorry. Good evening, Doc. My baby of 9 months is sick with tonsillitis, malaria. She's recovering. My major concern is that she refuses to suck breast. I hope she isn't on learning how to suck. Very unlikely for a child not to suck. But if your child is being treated for tonsillitis, you should see your doctors for follow up because they need to know why the child is refusing to suck. Okay, it's very important that that is sorted. Usually, children actually want to suck more rather than when they are sick, rather than stop sucking when they are sick. So, I want you to go back to the doctors treating the child and let them do further evaluation on the child and make sure. Sometimes some children stop sucking because we overfeed them already, so you've given all the other food and you're giving it a lot, and then you still want the child to suck on top. So sometimes the child is just so full, that is why they don't want to suck, not because they don't want to suck, but because there's no space again, and it's really because your child wants to vomit. So you need to be sure it's not that you are not overfeeding. Though going by your child's weight, the weight is not too good. Your child's weight is 7.1, an average 9 kilos. 9 months old should be weighing 9 kilos, and your baby has a very good weight, so 3 kilos at birth. So by now, your baby should be closer to 9 kilos rather than 7. But then maybe because the child has been sick, so that could have contributed to it. So, but I really think you should go back to the hospital and let them know that your child is refusing to suck. And it's important for us to know why. Because sometimes some children, when they have very serious infection, they may refuse to suck, and it's not a good sign. It may be a sign that tells us something is really, really wrong. Okay, I hope that's helpful. So Instagram may just Evers is asking about sepsis in children below 1 year. Sepsis just mean infection in the blood. It's not like it's any it's just like we tend to use it as a word for when germs, usually bacteria, are circulating in the blood, and when they circulate in the blood, they make the child to be sick, so they cause different kind of illness, usually fever. The child may not want to eat and all that. Then if they settle in a particular organ, for example, if they settle in the lungs, it will give the child what we call pneumonia. If it's settle in the brain, the child may have meningitis. It can cause all the infection in virtually all the organs of the body. And sepsis is a very serious illness. We need to treat it very promptly with antibiotics. Actually, most time we give the antibiotics into the blood so that it can deal with the bacteria and get it. So the most important thing for sepsis is not to mix it on time, which is a challenge in places where we don't like going to hospital on time, where our children will be sick. Last week I was really very upset because there are some things that are my pet peeves, things that tend to get me upset. Okay, all of us have that, but one of them is parents whose children are sick and they don't go to hospital, and people will ask questions. I can understand people ask me questions. My child was sick yesterday, today what do I do today? That's okay, that's a normal behavior. Okay, but people will tell me my children have been sick for 2 weeks, for 3 weeks, for 1 month, and I'm like, what are you really waiting for before you have to go to the hospital? Do you want a something to drop from heaven, like a voice? That always gets me really upset, because I'm like, that is why there are hospitals, that's why there are doctors, that if your child is sick, you take your child to them. You don't need people to tell you to do that. Okay, if you want to watch it for 1 day, I can understand. You want to watch it 2 days, but children are sick for 1 week, 2 weeks, seriously, what are we waiting for before we take them to the hospital? So please, challenge with sepsis is that if children sepsis is an illness that can spread so quickly. So if a child is ill, a child is having high fever, they are not eating, they are vomiting, they are breathing fast, they are not themselves. They what we call the interaction with you or with other people around them is reduced. It's an emergency. You go to the hospital, because sepsis, we have to pick it up on time and we have to treat it on time. And it's also a danger in a place where every illness is treated as malaria and malaria typhoid, and everybody has malaria typhoid in Nigeria. It's a major challenge. We mix those children really, and that's why sometimes some of those children may die, because nobody has done the needful and have not treated the children properly. So there is a fault from the parents, which is when we don't go to the hospital on time, and there's also fault from the doctors when we, especially our private hospitals. And it's always like I'm always coming down on them, but sometimes I don't know what is the problem, whether there are no right people there, or what is it, or is it the money? I don't know. But all these habits of everybody is just being treated for malaria, typhoid, we need to stop it. There are so many other illnesses. Sepsis is one of them. And when we miss them, it can be very fatal. So we really need to make sure that our children are being taken to the hospital on time by the doctors. And with the doctors, we make sure we're doing the right thing in terms of treatment of the children, and not just treating malaria. Even mothers now, they don't want to go to hospital because they say it's not just malaria and typhoid that I'm going to treat. So that's it. Okay, Gloria Hidalga, what are the preventive measures for bleeding gums? Okay, so bleeding gums in kids, that's a very broad question, but there are many reasons why gums could bleed. That's number one. The commonest one, I guess, is when children have gingivitis. They've not been brushing their teeth. There are plaques, depending on the age of the child, because you were not really specific with the age. Kids is really quite broad. So, but let's just start with common one. If children have gingivitis, they're not brushing their teeth regularly, they have plaques, then when they brush their teeth, it can bleed. So the solution to that is seeing the dentist. But before that, make sure you brush the teeth. Somebody has asked us a question earlier. Brush your teeth twice a day, before breakfast and after dinner. at night, the last thing they should do at night before going to sleep is to brush their teeth. Okay. Some children can also have bleeding gum from vitamin deficiency, especially vitamin C. We all remember our biology scurvy when we're in secondary school. So children who have vitamin deficiency, vitamin C specifically, they can have bleeding gums. Okay. Then there are other illnesses that can also, if the child is sick for other reasons, they can also have bleeding from the gums as part of those illnesses as well. But I guess the two most common ones are the oral hygiene thing, or vitamin deficiency. So if you take care of those two, unless the child also have what we call bleeding disorders, there are some people that bleed for other reasons, like children who have hemophilia, they have some factors that are deficient, factors that are responsible for clotting, they are deficient in such people, and they can easily bleed for no reason sometimes. So those are the common thing. But I guess the only one you can prevent is make sure your child eats a lot of fruits, because they will get vitamin C from the fruits, from the oranges, all the citrus fruits, their pineapple and all that. Let them eat a lot of vegetables as well, so they will get all those. Let them drink milk. Calcium is also important for healthy gums and teeth. And make sure that they brush their teeth twice a day using fluoride containing toothpaste that is age appropriate. And sometimes you need to supervise the children brushing. So it's not just for them to lick the toothpaste or just do something. Most time we just let them go and brush their teeth. Sometimes they don't do it properly. We need to supervise them, and we need to take them to see the dentist every 6 months just to make sure that they're doing well. All right. Omeke Abigail say, how do I ask questions on Facebook? Okay, our Facebook group, you can miss it on Facebook. So you just search for Ask the Pediatrician on Facebook. Once you're on Facebook, just look for groups or just type Ask the Pediatricians group. Our group will come up because it's one of the biggest Facebook groups for parents. So we have some look-alike groups, but just make sure you go to the groups that have the 700,000 plus members. Then you're in the right group. Any other group is not our own, even though they look alike. So then when you get to our group, you join the group, you can post your questions. The group is open 24/7, 24/6, not 24/7. We are not there on Sundays. So we are about every other day, Monday to Saturdays, 24 hours each of those days. You can post your question in our group and we will answer them. Please be patient when you post your questions. There are some questions that people will give you answer the very next second, but there are some questions that will have to wait for the specialist to come and give you the answer. So you need to be patient for those kind of questions. But we promise to try and answer your question within 48 to 72 hours max. So, but if your child is very sick, your child has, please don't come to the Facebook group. You have to go to the hospital. There are some things that are not Facebook. There are things that are not social media. A child who is sick have to go to the hospital. But if you want to ask questions, like some of the questions people have been asking now, you can ask on our group because they are not like emergency question, like how do I prevent bleeding gums? How do I brush my teeth? How do I? Those are kind of questions we are happy to answer because we can answer them in 1 hour, in 72 hours. We know your child is still okay. But if a child is having fever, child is convulsing, child is had a fall, child is bleeding, that's an emergency. Those kind of cases, you have to take the child to the hospital. So there are some emergencies. So, but there are a child who is otherwise well, but you just want to know how to do better by the child. You can always post that for us, and we'll answer that. Cynthia is asking, what causes muscle weakness? That question is very, very generic, not specific. Number one, I always want to know, how do you know the child has muscle weakness, and who told you the child has muscle weakness? Because sometimes people use words to mean something, but that is not the meaning to a professional. So if you don't mind giving us a little bit more information about that child so that we will know what you meant by muscle weakness, and then we will know how to answer the question, because usually most parents don't think their children has muscle weakness unless you've been to the hospital And in that case, they must have told you what if it's a doctor that told you about muscle weakness, then they would have told you why, because that's very important. But it's usually not a very it's not something parents use. It's not a parent's word to say muscle weakness. So I need to have that context and the age of the child as well, so that we don't uh go wrong and give the wrong answers. So I hope that's helpful. But if you're still here, just give me that information, then I will know how to answer your questions properly. Okay, I'm just checking Instagram whether they have questions. Okay, no questions on Instagram. Um, we've got a couple of more, 5 more minutes or 7 more, 8 more minutes. So if you still have questions, ask your questions. But if you're just coming, welcome to ATP Live. And if you are the people that are watching the recording, thank you so much for joining us. If you are watching beyond 7 p.m. on a Monday, Nigerian West African time, then you are watching a recording. You are not watching the live show. Okay, and so this message for those who are watching the recording. If you have any question after watching the recording, because if you drop a question as somebody who is watching a recording, nobody is here listening to your questions, so I won't be able to answer it live. So what you need to do, but we can still answer your questions, you have to go to our Facebook group. Go to the Facebook group and drop your questions there, and we'll be able to answer your questions for you. So the live session is just 1 hour, but we are online 24/6, 24 hours, Mondays to Saturdays, and we'll be able to answer your question. We normally take a break on Sundays. So for those who always come to ask me every blessed Sunday without fail why they cannot post on the group, we don't the group is closed on a Sunday. You can't ask questions on Sundays. You can always come back on Monday. And if it's an emergency, please go to the hospital. And I just want to remind us that emergency services are open 24 hours every day of the year, even on Christmas Day, even on New Year Day, because I do see questions. People were saying something like, oh, it's a public holiday. Yeah, that's why I can. No, there's something like that. If a child is sick, the children don't tell us, oh, I'm going to be sick, or so I'll wait until after public holiday. Children can be sick on Christmas Day, they can be sick on Easter. So we are always there. We are always in the hospital. That's why we do what we call calls. So there is always at least one or two doctors on call who is in the hospital even while you are doing your own festivity. There are doctors and nurses and health professionals who are always in the hospital. So they will always be there and they will take care of your child. Please don't give excuses. I see a lot of questions and people are like, why are you not in the hospital? Like, oh, I'm waiting for tomorrow, I'm waiting for Monday. No, go to the hospital. The children emergency room are always open. Okay, they are open 24 hours every day, 365, 366 days a year. And there is no state in the country that will not have at least either a teaching hospital or a federal medical center or a general hospital. There is no state, and I before you drive 1 hour in your state, you will get to one of those hospitals. Before you drive 1 hour anywhere in Nigeria, you will get there. So I don't like the excuses we make. Children don't have that reserve as much as adults. Children can get ill very fast and they can go very fast. And but if you come on time as well, they recover very fast. That's why I like pediatrics. So you treat the children. 1 minute the child is almost dying, then the next minute the child is running around in the emergency room and eating their ice cream. It's like magic. So that's one of the things I love about pediatrics. And like the adults that will always be pretending, even when they are well, they're always pretending they are not well. But their children, they don't pretend. So you do your job, you see the effects straight away. So it's always amazing to say that. So please always go to the hospital. Don't delay going to the hospital. Okay, I got one question from Abigail. Can a child of a year do rotavirus screening? Why do you want to do rotavirus screening? Was the child given rotavirus in immunization? Why do you want to do rotavirus screening? We don't do it routinely. There's nothing like you need to do. Or what are you asking? I hope it's not something else you want to ask. Because rotavirus is different from other retroviral. If it is retroviral you want to ask, it's a different thing. I guess that maybe that's what you want to ask, because I wonder why do you want to do rotaviral screening? It's sometimes the spelling can make a whole lot of difference. Okay, so rotavirus is a virus, and we don't screen children for it. It tends to cause diarrhea and vomiting. And that's why we give rotavirus vaccines at 6 weeks, 10 weeks, and 14 weeks. But I have a feeling that's not what you want to ask. I guess you want to ask me about retroviral screening, which is basically HIV tests. Yes, we can do HIV tests in anybody. Um, the way we do it in children below the 18 months is different from the way we do it in children above 18 months. So, but just go to the hospital. Yes, we can do it. And then, but usually for those age group, we'll rather do a DNA PCR test rather than a screening for children below the age of 18 months. After the 18 months, we can do the antibody screening test. But you don't have to worry, just go to the hospital, they will sort it out for you. Nina, good evening, ma'am. Okay, I gave birth to 33 weeks. March 9 was in incubator, neonatal unit, discharge after 2 weeks. He's being fed via a feeding tube, but discharge, I'm supposed to feed him every 3 hours. But it takes time to swallow and see the breast milk in his mouth. We can be on one feeding for more than 3 hours because it takes time to swallow and it is really stress. I can imagine. What is the weight of your baby? Number one, your baby is preterm, but then what you are describing is worrisome for me because your 33 weeks is almost like a 33 weeker is almost like a term baby. So a 33 weeker should be sucking directly from your breast. So for the fact that your baby needs to be fed via a feeding tube and the baby is taking hours to feed, it's something worrisome. You need to go back to see the pediatrician. There is more going on. I know you are trying to be brave and yes, but there are more issues with this baby than you've told us, to be honest. So I don't know why was the baby in neonatal unit for 2 weeks? That is not quite. We don't usually admit a 33 weeker for 2 weeks. So again, what's the birth weight of the baby? Why was the baby in incubator for 2 weeks? What was the problem? Why does baby need a feeding tube? There are many questions that I need to ask because I'm not there. I didn't see your baby. So I know you are trying to summarize for me, but there are information that are missing. And because of that, I can't answer that. But it is definitely not normal for your baby to be taking 3 hours to feed. For a 33 weeker, no, that is not normal. So I want you to go back to see the pediatrician who manage your baby while the baby was in NICU. They shouldn't have discharged your baby if your baby is not yet feeding, your baby is not yet sucking directly from the breast. And unless there is um some abnormalities with the baby's ability to feed. Does your baby have like a cleft palate or any of those congenital anomalies? There must be something that you've not told us that is responsible for this poor feeding, but you need to go back to them. You need to see the pediatricians, and then they can take it up from there. Yeah, even if the feeding tube. Okay, let me see what information. Birth weight is 1.9 exactly. A 1.9 old baby should be sucking directly from the breast. Usually from 1.5, we want them sucking from the breast. So, why was the baby not sucking? Why is baby not sucking from the breast? Why does baby still need a feeding tube at 1.9 kilos? So is your baby sucking from the breast? So I need to know that. Yeah, there's something more going on with the baby than what you've told us now. It's a little bit tricky, but it's not something we can solve on Facebook. It's something you need to go back to see your pediatrician There are more going on with the baby than what you've told us. So you yourself may not even know, or maybe they didn't explain it to you. Because number one, you're 33 week, 1.9 kilos, does not need to go to NICU, does not need to have feeding tube, does not need to be in incubator for 2 weeks. 1.9 kilo will stay with the mother in the world. So the fact that your baby needed to do all those things, needed a feeding tube, needed to go to NICU, is still struggling to feed, tells me there is more going on with the baby. And that is actually the issue that we need to address. So I really need, you should be seeing your pediatrician anyway. I believe they gave you follow-up feedback appointments. So you definitely need to see them. So is your baby sucking? If you put him to the breast, is he sucking the breast? So if your baby is sucking the breast, just let baby suck on the breast. But you need to see your pediatrician. That's just the yeah, it's not something we can solve on Facebook. You need to see a pediatrician. The pediatrician will manage your baby for the past 2 weeks before the discharge. You need to see them. Cynthia said my baby is 7 weeks, birth weight 3.2, 4.6 real BF. It doesn't suck for long. Are you the one that's asking about muscle weakness? Yeah, that is not muscle weakness. Baby doesn't have muscle weakness. That's not the definition of muscle weakness. Okay, so don't say the baby has muscle weakness. Yeah, babies, newborn babies are learning to suck. But your baby is sucking, your baby is getting enough breast milk because your baby is gaining weight. So the way we know whether your baby is getting enough breast milk is by the weight. That is the most objective evidence of a child who is getting. If your baby is not getting breast milk at all or it's not getting enough, your baby's weight will be 3.2, or the baby may even be less than 3.2. So the fact your baby has gone from 3.2 to 4.6. So your baby has gained 1.4 kilos. Yeah, 1.4 kilos in 6 weeks. That is awesome. That is good. The baby is getting enough breast milk. So you don't need to worry. It's not about how much baby stay on the breast that determine whether baby is sucking enough or not. It's not how much baby stay on the breast. It is how much milk is going into the baby. And the way we as pediatricians know that milk is getting to that baby is by the weight of the baby. So if baby is not getting milk, they don't gain weight. So if baby is gaining weight, baby is getting enough milk. So don't worry about don't and maybe people have told you the baby needs to stay on the breast for 30 hours or 30 minutes, 1 hour. No, baby does not need to stay on the breast for 1 hour to get milk. Okay. So baby suck is enough. That's it. So um the most important thing you've told us is that baby is gaining weight, and that tells us that baby is getting enough breast milk. 15 minutes is more than enough for the baby to suck. That is good. That's good. Okay. So Cynthia, I guess you must be a first time mom because you're worried about so many things that you don't need to worry about at all. So your baby's weight is fine. 15 minutes is absolutely lovely for a baby to suck, and baby you need to suck every 2 3 hours max. So they don't need to worry. Don't start to worry and get anxious because in the process you are actually going to reduce your breast milk. Then you fear, what Job said, what I fear has come to me. Then that's actually what can happen. So just relax. I can assure you that your baby is fine. Your baby is sucking long enough, and your baby's weight is going up, and that is the most objective evidence of a baby who is sucking well, who is getting enough breast milk, is that weight, and it is perfectly perfect. So nothing to worry about. All right, so Lina, please see your pediatrician. I'm really worried about your baby. Honestly, I really, really want you to go back to see your pediatrician. It is extremely important that you see them, if possible today. If you can't do it today, do it tomorrow. Feeding is a major issue in a preterm baby. In a baby was in NICU, that baby needs to be monitored closely because we don't want to undo all the good work they've done for the past 2 weeks. So you need to go back to them. One of the indication for discharging your baby should have been that your baby is eating well before your baby go home. That is one of the things we use for discharge criteria. Like, okay, is this baby ready to go home? Is the baby ability to feed? So your baby is staying 3 hours on feed. Why? I mean, is it how many hours you say? Yeah, 1 hour or 3 hours. So if your baby is staying 3 hours on feed, they shouldn't have discharged the baby. They shouldn't have distracted the baby at all. Yeah. Yeah, one feed is taking more than 3 hours. No, they shouldn't have discharged a baby who is still taking that long to feed. No, no, they shouldn't. So the baby needs to go back to the hospital. They need to know what is the problem and they need to solve it. They need to sort it out first before you go back home. Yeah, that's it. All right, thank you everyone. Excuse me, my time is up. If you still have any question, please go to Facebook, ask the pediatrician Facebook group. I'm trying to see whether I can copy the link to our Facebook group, and then you can ask your questions there Monday to Saturdays. Please be patient with us. Once you drop your question, we will give us a little bit time. We will come to answer the questions for you. But like I said, if it's an emergency, please come and see us in the hospital. We'll be there. So that's the link to our group for who is asking? Omeke Happy Girl. Yeah, that's the link to our group now. You click on it, it will take you to the group. If you're not a member, just join and then you can will approve it very fast, then you can start asking your question. So have a wonderful evening, and hopefully maybe I'll see you on Thursday, or maybe one of my other doctors maybe doing a teaching on any of the topics that is relevant to the health of our children. Before then, have a wonderful evening, and it is bye bye from me. Bye.